My name is Sue. My background is really in IT, and so you will excuse me if I don't hit any of the words on the bingo card because I know very little about research. But hopefully I shall be able to give you a flavour of how, where connected health is in Northern Ireland, what is connected health, and how maybe in some of the things that we've done in connected health, we've been able to support research. So I work for an organisation or a directorate within the Public Health Agency called the Centre for Connected Health and Social Care. I'm going to talk a little bit about the service that we have put in place, which is the Telemonitoring NI service. And then I'm going to talk a little bit about the EU funding, partly because a bit of our work is also to support the development of connected health in the EU arena. And as Ian has said, we will be, by participating in some of the EU work, we gain a lot more knowledge, and again, I'll demonstrate some of the benefits of that. And then really, the last bit is really perhaps to get you to think a little bit about connected health opportunities within the social care world. So a bit of history, 101. We were set up in 2008 as the European Centre for Connected Health. It was set up by our main reason was to really look at bringing improvements in the world of technology for patient care. So traditionally, a lot of organizations, including the health service, have looked at setting up using IT to benefit staff, management, policymakers, but not quite a bit that is actually looking at benefits, delivering benefits, innovation for patient care and client care. So we were hoping, we were set up with the intention of more outward looking towards the service users, improve patient and client experience, quality, effectiveness of care with technology, and then again, hopefully with that, enable us as a healthcare system to be able to respond better to care in the future. And then again, part of it is again, as I've said, to support the European e-health agenda. I'll talk a little bit about the telemonitoring service that we've put in place. In 2008, we commenced the procurement of a provision of an end-to-end remote telemonitoring service. It was initiated by the Department of Health as part of their modernization agenda to hopefully put in place a service to help people help us look after people with long-term condition, e.g. Heart failure, COPD, diabetes and stroke better. And in 2011, we were awarded a 6-year contract to a service provider that is at the moment currently delivering the service for us. To date, we have had more than 4,000 patients who have benefited from the telehealth. And in the telehealth, I refer to vital sign monitoring. So essentially for those long-term conditions, the desire or the aspiration at the time was to allow us to monitor vital signs of individual patients in the home environment in order to really help us understand what's going on with the patient while they're at home, to support them for self-care, self-management, to provide an early warning for us to understand if there were any exacerbation of the condition via the vital sign to give us an early indicator so that we can then do early intervention work or prevention work. We also have more than 3,000 people who have been using telecare. Now, again, I'm not sure whether people understand what telecare is in the room. Maybe quick show of hands of people who might have experienced telecare. So not a lot of people. Since 2013, we have then developed into other areas because it's vital sign, including temperature, pulse rates, heart rate, blood sugar, BP. Then we were able to diverse into other areas such as weight management and renal. And then again, within the telecare, we were able to roll it out to more trusts to avail of the sensors and alarms that we could use to help people manage risk and safety. And I'm going to run through to the next bit of where we have supported research. We have been able to use telehealth to support three or four projects, really mainly in blood sugar monitoring for diabetes care, Way to a Healthy Pregnancy, which is weight monitoring for maternal obesity project. And again, at the very end, we are actually evaluating our own service to see whether we meet what we have set out to do in the very beginning. So again, I'm not going to run through these in detail because obviously, but again, they're on the slides if you want to refer to them in greater details. Okay. And then again, just to say, I'm also going to be involved in another project, which is part of the HNC R&D, which is to take the next stage of that Telemom, which is kind of monitoring gestational diabetes, to the next stage, because they want to put in a bid for the Northern Ireland, the national NIHR program. So we're actually using from that, leveraging from that to actually go to the next stage. I'm going to run now quickly to the EU aspect of our work, just to again demonstrate. Now, again, we recognize from our conversation with stakeholders in the European areas that e-health is becoming a higher agenda. And I think if you look through some of the funding calls, e-health is the use of technology is almost always something that features in most of the calls. Why do we need to go into EU? As Ian has said earlier, we need high quality, we need additional knowledge, we need to be able to develop the types of collaboration. So there are opportunities for professional collaboration, knowledge exchange, and again, it's an opportunity to showcase what the good work that we have done in Northern Ireland to the rest of Europe. Again, a little bit of just what we do. We kind of act as a hub within the HSC, not just on, obviously, HSC R&D will do the research bit, but we kind of look at joining the dots and, from a service improvement, innovation, e-health perspective to try and pull different partners together and support them. And then again, this is just a quick run through of the various types of e-health EU projects that we have had the opportunity to engage in the past, as well as some of the ones that are ongoing. And as you can see, in the domain area, it's very varied, ranging from integrated care to pre-commercial procurement, and in a range of areas as well. And again, some of the types of funding that we've been able to receive, benefit from. Quick run through again on one of the projects that I was personally involved in. It's with 6 different partners, of which they were Scotland, Norway, Sweden, Finland, and Ireland. And again, it was about looking at how we could use technology to benefit people in rural areas. So again, it's part of innovation, part of learning what others have actually done. And we were very fortunate that we were able to have partners from Scandinavian countries, because the Scandinavian countries, as you know, some of them are very remote, so they have had no choice but to actually use technology in a better way than we have. Again, at the final evaluation of the project, these were the potentials, impact that they've actually been able to derive. So from the 6 countries over the course of the 3 years, we were able to deliver services to 3,890 patients as a direct result of the project. 560 staff were involved in the demonstrator projects. Because mainly it's telemedicine, which is using video conferencing and other types of remote technologies. In terms of the carbon emission savings, that's quite substantial. That that's another environmental impact that we didn't foresee, but actually is measurable. Again, new services that have been implemented. So again, we've learned a lot. And in Northern Ireland, we were able to deploy at least 3 video conferencing projects in the area of renal, diabetes, and speech and language therapy. We were able to share knowledge of what we've had in telehealth, telecare with other countries, and learn from how they would have deployed it differently. And again, develop professional expertise. We also had knowledge exchange. We were able to bring people over to Northern Ireland to again let us speak to them, and vice versa, to start that conversation. And as you can see, it was very much multidisciplinary. From SMEs all the way to individual patient who brought along very valuable patient experience of what they felt were needed to be done in terms of diabetes care. This was one of the projects that we implemented. I have no time to play the video, but if you will go and look up YouTube, you will see this particular project, which is actually a video conferencing project to support speech and language therapy for post-stroke rehab. And again, from this particular project, the patient benefited that they didn't need to travel into hospital. They benefited from additional session because the therapist did not have to travel long distances. She was able to increase the capacity. She was able to reduce the time that she sat in looking for car parking, go back to base. Simple things, but all that time that added up, she was able to. And then obviously, her own professional development, having been exposed to the technology, she was then able to think about other opportunities to apply what she had learned in this area to other areas. So at the moment now, the Trust is looking to develop this technology for Parkinson's patient, because from a speech and language therapy, she could see the benefit of how this could be reutilized. So it's more the application of technology and the understanding. I'm going to run through this again very quickly, again, bearing up, just to let you see the different types of funding that are available. And again, Patricia, who's on this afternoon to talk about Horizon 2020, will give you a bit more details. Now, they tend to generally be quite health-orientated, but I've circled one or two that actually might have opportunities that you could then maybe have further conversation with Patricia or ourselves or any of your other colleagues, if you so wish. So really, at the end, these are the drivers, similar to all the other areas, healthcare, these are all the things that we know exist at the moment, but there are plenty of opportunities in terms of the connected health. I was talking to somebody this morning about something I'd read recently about a young girl who had autism, and she was nonverbal and she wasn't able to communicate. And just from the virtue of being able to be given a keyboard at the age of 10, everyone realized that she could actually communicate, she could type. And from then on, she's now has her own blog that she's not only just being able to communicate to the people around her, she's now able to communicate through the internet and advising other people who have professionals and people like her alike of what the potentials of technology and connected health. So I'll leave you with that, and I was going to leave you a blank page because I think for social care, it really is a blank page. You could start anywhere, but the opportunities are there for all the different types of connected health that could be done. Thank you very much.